Millions of COVID-19 vaccine doses are coming faster and sooner than expected. Moderna has agreed to bump up some of its July shipments. It will send an additional 5 million doses this month, moving them ahead. It means Canada will get 15 million doses of Moderna just in the month of June. We'll also get another 6 million doses in the first 2 weeks of July. Now, if you add the AstraZeneca doses and the massive Pfizer supply, Canada is on track to receive a total of 68 million cumulative doses by the end of next month. Anita Anand is the Minister of Public Services and Procurement. Minister Anand, welcome back to the show.
Hi, David. Great to be here.
Start with the math, and the numbers are looking pretty good. You're forecasting about 69 million vaccines by the end of July, but you did warn today that the supply chain is still volatile. So how concerned are you about your ability to hit those targets with that volatility?
Well, thanks so much. I only come before Canadians when I have affirmed delivery schedules from the suppliers. And so the 68 plus million doses that will be in the country prior to the end of July are made on the basis of confirmations that I've received from both Pfizer and Moderna. Having said that, I did say and will continue to say that we are operating in an extreme global volatility in terms of the demand for vaccines. All countries are clamoring for the same product at the current time. And therefore, we are still watching every plane that lands and every shipment that comes in to make sure that Canada is receiving the doses that we have been promised, and that those doses are getting out to provinces and territories and into the arms of Canadians. We have, as you know, hit the 75% mark of eligible Canadians to receive 1 dose of vaccine, but we have a long road to travel in terms of 2 doses for every Canadian. And in that regard, I will continue to bring in millions of vaccines for Canadians so that we can make sure that all Canadians are double vaxxed as soon as possible.
Well, the latest delivery schedule that you've outlined today of the 69 million, that's rough math. That's enough for every eligible Canadian at this point to get 2 shots. The big change in that, or the big news in that, is Moderna. After sort of being habitually late and habitually kind of short because of supply chain issues, since they started delivering from the U.S., they're ahead of schedule and over promised volume. I mean, how much of a game changer has that been on the procurement side?
Well, David, let me just tell you what we are doing in procurement vis-a-vis our suppliers. We are not sitting back and resting on our laurels, if you will, in terms of the contracts that we signed up last August. Those 7 contracts were the foundation of our access to vaccines. But what I do every day, and my team is currently engaged in, is to press the suppliers for more and more vaccines earlier and earlier. And on the basis of that effort, we have already accelerated 34 million doses of vaccines from later to earlier quarters in this year. So that's the work. We are pressing suppliers, and we are building on the foundation that we laid with those contracts. And that's how we're getting to 68 million doses prior to the end of July coming into this country. It's because of the continued aggressive push that we are making at the Government of Canada.
I wonder what your conversations are like now, though, with AstraZeneca, Covishield, and that particular supplier of vaccines, given the changing situation in the country and the changing guidance from NACI. I mean, they've already said we don't recommend it for first doses, and now they're more or less saying we don't recommend it for second doses, and people should go to an mRNA vaccine if they can, that is the preferred option. So given that high level of guidance and the high supply of the mRNA, which is coming in big volumes, what do you do with your AstraZeneca orders now? Does this become something you donate to the world, or do you keep buying something that the advisory committee is kind of recommending we don't use as a big part of what we're doing?
Well, it's a great question, and I want to start by saying, again, that our contracts are strong, our relationships with our suppliers are strong, and if the demand is present, we are able to bring vaccines of approved suppliers into Canada. At the current time, my team's engaged with Minister Haidu and the Public Health Agency of Canada, who are on the front lines with the provinces and territories to determine the demand for particular vaccines, and in particular AstraZeneca, within these jurisdictions. And as soon as we have that firm information, we will be able to supply vaccines of any sort to the provinces and territories. And indeed, we are quite willing to continue to supply AstraZeneca to jurisdictions that want it. We have the contract in place. We are able to bring in doses for Canadians if the demand is present.
But do you think that demand is there? It seems like, anecdotally you hear that, look, I got AstraZeneca for my first shot. I'm getting an mRNA for my second shot just because that's what the science says. And it seems like a safer choice for me at this point, given where the pandemic is. I mean, do you believe the demand is there? Because there's tens of millions of AstraZeneca still under contract, right? So is there any point in even buying them if people look like they're going to be reluctant to use them?
Let's be clear, we have 20 million doses of AstraZeneca contracted for with the corporation under our APA. And your anecdotal evidence is saying that the demand may not be there. My anecdotal evidence actually says that some Canadians want AstraZeneca. And in fact, all of the provinces have not automatically signed on to NACI's guidance. So there is still work to be done in terms of discovering how much demand is within the country. We are working with the provinces and territories to find out what they want from us as a federal government. My job all the way along has been to continue to bring in vaccine for Canadians. 68 million doses, David, before the end of July. That is a very important number for us to remember today.
No, and that is a very important number, and it is a very good number. But there are some other numbers still to talk about, right? Like the 300,000 Johnson & Johnson that you sent back because of the contamination issues that were uncovered at the plant, I believe, in Baltimore, that led to the Americans destroying tens of millions of doses. What do you do there now? I mean, are you going to get those 300,000 replaced? And given the sort of, again, the VIT concerns around J&J with the abundance of mRNA, are you going to still pursue that aggressively? Or it seems like you're just going to buy everything you can and let the provinces figure out what they're going to use. Is that a safe description?
Well, let me be clear. We are operating with two tracks here. The first track is to make sure that we have enough vaccines for all Canadians to be double vaxxed, should they want that vaccine. Okay. The second track is to ensure that we are supporting our multilateral commitments to the developing world, to make sure that we are part of COVAX. Our Prime Minister last week committed to 100 million doses to the developing world, and we are going to continue to make sure that we support COVAX and the pooled procurement mechanism that it stands for, and our willingness to reach out to other countries extends beyond vaccines. When India was at the height of its third wave, you'll recall, David, we sent over supplies, ventilators, oxygenators. So we are focused on this second track, an outward-facing track, as well as the initial track that you hear me speak about every day, which is delivery of vaccines for Canadians.
You mentioned COVAX and the commitment to deliver up to 100 million doses that came out of the G7. The vast majority of that is cash, right? You're going to buy other doses, already commitments that have been made through the ACT Accelerator, and that is important. I don't want this question to make you think I'm diminishing that. But when people think of donations, it means something you have that you don't need and you're going to give. So at which point does Canada start donating Pfizer that it buys or Moderna that it buys to other more needy countries? Because we are pretty close to hitting all the magic thresholds we want to hit on our vaccination. At what point do you start giving the mRNA to other countries?
Well, it's a good question. This is an ongoing conversation across government with regards to our vaccine procurements and the doses that we expect to come in. But I want to be clear, David, that we are still watching their supply chains very carefully. We have heard from Pfizer that they will still deliver 9.1 million doses in the month of July, but their shipments are going to ramp up towards the end of the month. And that is a very important moment for us to reflect on the fact that we still have supply chains that are ramping up, that are very stressed because of global competition and the ongoing acceleration that suppliers are making towards supplying the world with vaccine. And so I don't want to take anything for granted on the Canadian supply front. We have to be very vigilant and make sure that the vaccines are coming into this country and out to the provinces and territories so that everyone can have their 2 shots.
Okay, Minister Anand, thank you so much for your time.
Thank you so much, David. Have a great weekend.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.